So the start of the new year means resolutions are usually in full swing, and for some that could include some weight loss goals and improving your overall health. So Dr. Patrick Davis with TriStar Southern Hills is here to talk about some weight loss surgery questions. So Dr. Davis, good morning. And
good morning.
Thank you for
having me.
We're glad to have you, because I know this is a question and a topic that's on a lot of people's minds. When we talk about weight loss surgery, what do you mean by that exactly?
So in the first of the year, there's always a big push, a lot of new resolutions to help move forward with developing a healthier person. Anytime we talk about what avenues we have, we talk about the kind of different tools that we can use to help with weight loss, whether that's diet and exercise plans, even some prescription medications. What surgical weight loss has been shown to be is not only the most effective form of weight loss, but more importantly, the most sustainable form. A lot of those other forms do yield some results, but the question is, are they sustainable in the long run? And the vast majority of the time, the answer is no, they're not.
Interesting. So who are some of the best candidates for when it comes to weight loss surgery?
So when it comes to weight loss surgery, of course, there are specific requirements from an insurance standpoint that do require some level of obesity, is the technical term for it, which is a BMI of greater than 35, which is a marker that has to do with both height and weight. But more importantly, what really is important in regards to who's the best candidate is someone that is driven, that knows that they're going to have to put in some good hard work and move forward and just kind of continue to work on a daily basis. And this is a chronic, long-term problem that doesn't have a short-term fix, unfortunately.
So do people sometimes think this is the easy way out, or the easy way towards being...
That is an unfortunate common misconception. It is an easy way out. And any patient that's ever had this has done very well can tell you that it's exactly opposite.
There's
nothing easy about it. It's a lot of hard work. And those are the patients that do the best, the ones that really put in their hard work.
What are some other misconceptions that you think are swirling around out there that people might not know about?
One of the ones that I always struggle with is the misconception that having to proceed with surgical weight loss is a sign of failure on the patient's part. There's a lot that we know about weight and weight management now that we didn't know even 10 years ago. There's a lot that we cannot control about our own weight that goes into everything from genetics to metabolism. And so there is that unfortunate misconception that by needing surgery, they're either one, taking the easy way out, or two, have failed at all other attempts.
That's awful to even think about. Some of this is just so emotional at the end of the day, too.
Very much so.
So what's your advice for someone who is watching this segment, they're thinking about this? What are some of the next immediate steps that they should take?
So the most immediate things that I would recommend, get online, do some research, but of course, like with anything online, take it with a grain of salt, and talk to your primary care doctor about it. They can facilitate engaging them in a discussion with one of the several bariatric surgeons here in Nashville.
Okay. And what's the recovery typically like when someone, I know everyone's different, but how is that?
So thankfully nowadays, the majority of these surgeries are now fairly short-term in the hospital. They're usually one night in the hospital. The dietary modifications are of course important, but in regards to extreme modifications, they're not very long. Patients are generally on a liquid diet for about 2 weeks afterwards, and more of kind of a blended pureed soft diet for 2 weeks. Then after a month, they're back to regular consistency foods and hopefully making just more healthy changes.
For that long-term impact at the end of the day. All right, Dr. Davis, thank you so much for your time this morning. We appreciate it. Folks, if you're interested, we're going to have some more information about how you can contact TriStar Health. Just go to our website, WKRN.com, and look for the Newsmaker tab.